my name is Lexi Kuenzle, and this is my vital signs video. I'm going to start by washing my hands for 30 seconds to get all the bacteria off. If you don't want to count 30 seconds, you can sing the happy birthday in your head 2 times. Okay, now let's meet our patient. Hi Claire, my name is Lexi and I'm going to be taking care of you today. I'll be your nurse. Can you tell me what brings you in today? Just to check out. Can you tell me about your family history, any disease, any problems?
Nope.
What about for you?
For me, I think I have a history of some heart disease.
Yeah?
Yeah.
Okay. Let me just write that down. Do you have any allergies?
Nope.
Are you allergic to any medications? Okay. Are you currently taking any medications for anything?
Nope.
No? Okay. Have you had any surgeries, problems, injuries, operations in the past?
Got stitches 2 years ago.
Oh, really? For what?
Just my life. Cut it
Oh,
open.
okay. I see that. It's okay now, though.
Okay.
Okay. I'm going to proceed to take your vital signs. First, I'm going to need to take your height and weight. So if you want to step over here. I'm going to take her height and weight. You're 65 inches, which is 5'5". You haven't grown since last year. I think you're done growing.
Okay.
I'm going to have you step up on the scale now. Right over here. I'm going to set it to 0. You're at a healthy weight. Glad to know.
Good to know.
I'm going to proceed to take your temperature. I'm going to get it from the ear because that's the closest to your core. And the normal range is 96 to 99. Okay, your temperature is 98.6, which is a healthy temperature. You don't have a fever, which is very good. Okay, now I'm going to take your pulse, and I'm going to place my 2 fingers on your radial artery in between the 2 bones, and I'm going to count for 30 seconds. Beats per minute is very normal. The way I got that was I counted your pulse for 30 seconds and then I multiplied by 2. The normal range is 60 to 100, so you were right in between there, which is very healthy. I was also looking to find a normal rhythm in your beats. The normal rhythm would be dub, 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 where an irregular beat would be like dub, love, love, dub. I also checked the force of your pulse. A 0 means that there's no pulse. A 1 plus means that it's weak. A 2 plus is the normal range. And a 3 plus may mean that you are bounded. And you were a 2 plus, so that's very normal. A 1 plus may mean that there is injury. And a 3 plus may mean that the patient is anxious. Another thing that I was looking for was the elasticity in your veins. Yours were very spongy. spongy and bouncy, which means that they are healthy and blood is moving through the veins. If they were hard, that could mean that you have atherosclerosis, which is a little blockage in your veins, and we would have to do some further testing if I felt that, but you're healthy. Another thing that I looked for was your respirations. I didn't tell you this in the beginning because then you could have, changed your breathing, your normal pattern. So I got 12 breaths per minute, and I got that by counting 30 seconds, and then I multiplied it by 2 to get a whole minute. I also looked for your chest, and I saw that your chest was moving evenly, rising and falling, which is very healthy. If one side was going further than the other, that could mean that you're moving more thorax, which is a collapsed lung, but you're very healthy. Yours are moving very symmetrically, which we want.
That's not great.
The normal respiration rate is 10 to 20 breaths per minute, and Claire's was normal. Also, when I was looking at you breathe, I was just making sure that you weren't hunched over or you didn't have pursed breathing, because that could indicate fluid retention or fluid in the lungs. Now I'm going to take your blood pressure. I need you to keep your legs uncrossed. I need you to rest this arm right here and keep your arm at the same level as your heart. The cuff shot size should be between the shoulder and the elbow to cover 60% of your arm. Make sure that the cuff size is the right one for the patient, so this one fits you well. It's not falling off, but it's also not too tight for you. I'm going to use the diaphragm side of my stethoscope. I place the cuff 1 inch above your brachial artery, and the arrow is pointing at your brachial artery. So now I'm going to use my two fingers to try to find the correct placement. And we can start.
Go.
Perfect. Your blood pressure is 120/80, which is very normal.